From MaryHaven Center of Hope, President Louis Grossman, New Hope Director Jim Morse, Nassau Alliance for Addiction Services President Sal Femina, Family and Children's Association Executive Director Dr. Jeff Reynolds, Long Island Council on Alcoholism and Drug Dependence Director of Development Cynthia Dorler, Families in Support of Treatment Executive Director Anthony Rizzuto, and Linda Ventura, mother of fatal heroin overdose victim Thomas Ventura. Today, we're here to offer hope and assistance to those struggling with addiction and their families during a crucial time by committing funds to help these people get through this crucial time and close a deadly treatment gap. We all know that heroin is an epidemic, both nationwide and locally. The CDC reported last year that overdose rates have increased more than 100% and over 211% in the Northeast. And we are not untouched by that here in Nassau County. The use of Narcan, which my office has helped distribute through the Heroin Prevention Task Force, has stopped some of the death by reaching these overdose victims and saving their lives, but that is enough. That is not enough. We need more long-term solutions to help this problem. And that's what we're here to announce today. Since I took office in January, fighting this epidemic has been one of my top priorities. My staff and I regularly meet with law enforcement experts, treatment experts, and parents and others related to those who have suffered overdoses and who are in the throes of addiction. We have come up with a three-pronged attack on this problem. The first prong deals with tough enforcement and the creation of better laws for those who deal this death in our communities. The second prong is education in our schools, speaking to students and the parents so that they know the signs of addiction and helping them prevent addiction. And number three is the effective treatment, like we're going to talk about today. We have to use every tool available to fight this battle. And when those tools aren't available, we create them. Recently, I announced my office's authorship of several bills made available to prosecutors against heroin dealers. We announced our death by dealer bill, which creates a new homicide statute against dealers whose customers die from the product. We also made another bill to ensure that the worst of the worst heroin dealers would not qualify for non-jail diversion sentences. Other bills in our package go after dealers who sell to children and what we call dealers in lab coats, those doctors and pharmacists who sell opioid prescriptions for profit without a legitimate medical justification. Today we're announcing a new initiative to close a deadly gap in the treatment options available to Nassau County residents. Right now, heroin users who overdose are usually revived and released right back into the community in a matter of hours, right back into the situations that cause these problems, with recommendations and a piece of paper saying to obtain treatment. Since heroin and opiate withdrawal is not considered medically life-threatening, they are not kept in hospitals. Processing the paperwork can take weeks, and getting into the appropriate treatment also can take weeks, and those are days that these people do not have. Currently, New Hope staffing does not allow this facility to admit patients during overnight hours when many overdoses occur. The treatment gap leaves many patients on their own during the most difficult hours and the most violent times, often leading to repeat use, and sometimes leading to criminal behavior when those addicted are looking for money to find their next hit and feed their habit. This cycle leads to crime, and we're here to stop it. Our new initiative closes this treatment gap here in Nassau County by providing the funding that it will allow New Hope, the only medical monitored drug crisis center in Nassau County, to meet overdose patients in ER rooms, in emergency rooms, at any time of the day or night, and transport them here safely to be stabilized through their withdrawal and receive counseling until long-term treatment can begin. There is no cost to the patient because this will be paid for using the DA's office criminal forfeiture, asset forfeiture funds, and there is no cost to the taxpayer either. My office's funding will allow New Hope to hire medical and psychiatric staff who will be available to provide medications to those who need them, while other staff assist patients with the cumbersome process of getting their applications filed and getting through to the next phase of treatment. This is a stopgap measure that will allow a seamless entry into more longer-term treatment from the emergency room. The heroin crisis has hit every corner of this county and this state. We are doing everything we can to beat back the crisis. When I became a prosecutor in 1991, the crack epidemic was raging, and we learned a lot then. And we learned that we can't arrest our way out of this problem. We need treatment, and we need treatment that people can afford and that people will stick to. I believe we can do the same with heroin, working together with law enforcement, with our treatment providers, with those who have suffered through addiction, and those family members who have given that support during that addiction. We can beat back this terrible crisis. That's what we're doing with our three-pronged approach at the DA's office. Today, I'm heartened and I'm thankful for all the people that stand with me who gave us their advice and helped craft all of our approaches to heroin. And right now, I'd like to introduce Lou Grossman, the CEO of MaryHaven Center for Hope.
I just would like to reiterate the comments that were made. MaryHaven, part of Catholic Health Services of Long Island, is delighted to be part of the three-pronged approach. And as indicated, the dollars will be put to excellent use to provide the staffing to enable us to provide 24-hour admissions to this facility. So I thank you.
Okay, I think Sal Lafamina from the Nassau Alliance for Addiction Services.
The Nassau Alliance for Addiction Services is addressing the severe consequences of this heroin epidemic. We have a number of member agencies that provide treatment throughout the county. We are so pleased to see that this is going to happen, where there will be people available to receive treatment immediately after being rescued and sent to a hospital. What happens now is people generally turned out to the street, they use again, and by the time they access treatment, sometimes it's too late. So we're incredibly pleased to see that this is going to happen. And this is a long waiting for event. Thank you. Sorry.
Okay, now we're going to hear from Family and Children's Association Executive Director, Dr. Jeff Reynolds.
This is a great day. The heroin crisis on Long Island is not especially new. It's something that's taken hold over the course of the past decade or so, yet there hasn't been a dramatic expansion in treatment availability in Nassau County. So this marks, I think, a huge step forward. The other area where we've seen some progress is in the reduction in overdose fatalities because of Narcan. Narcan should never be the best we can do. It should be the least we can do. And we need to make sure that as we rescue folks, as we bring them back to life, that we're creating a path towards recovery. This move on the part of the DA absolutely does that. I also want to say it is heartening to see if anyone who could have stepped up to address this issue, that the DA is doing that and recognizes that a law enforcement approach to this is absolutely critical. We need tougher laws, but we also need to make sure that those folks who legitimately need treatment get access to that treatment. So I applaud the multi-pronged approach that you're using here in terms of law enforcement, prevention, and treatment. This is a big step forward and undoubtedly will save a lot of lives here in Nassau County. So thank you for your work and thanks for the folks at MaryHaven. Dr. Jeffrey Reynolds, J-E-F-F-R-A-Y Reynolds, R-A-Y-N-O-L-D-S. I'm the President and CEO of Family and Children's Association.
Okay, Families and Supported Treatment Executive Director Anthony Rizzuto.
Hi everyone, thank you liaisons. Thank you for inviting me and thank you for taking this big step. As a clinician, I will tell you that often a person in the throes of addiction does not want to get help. But when that time does come, that they are ready to get help. We need to be able to have treatment on demand. That is something that's been lacking. In my opinion, that's been a big cause of the overdose deaths. This is a big step in being able to realize treatment on demand and connecting people with the help that they need. The other part that's really interesting to me is that there is no cost to taxpayers, and the money that's being used is from forfeiture funds. So I commend the creativity, and I commend you for taking this step. Thank you.
We'll also hear from Linda Ventura.
Good afternoon. I absolutely want to commend you for taking the initiative to bring forth your approach. It is time for us to come together as communities, as Long Island, and to do everything possible so that no family member has to join my club. I lost my son 3 years ago, and undoubtedly, New Hope will save lives in that crucial time after an overdose. They typically, a person struggling with addiction will go back out and do exactly the same thing again. So it also will give the families a moment to seek help and treatment for themselves, which is also very necessary. So thank you so much.
Questions?
I just wanted to ask you, Ms. Singas, how long can this new funding sustain this program, and what's the capacity in terms of how many patients can be handled, on a weekly, monthly, or annual basis?
Well, I'll let the capacity question be answered for Mr. Jim. But as to the funding, we've committed to the funding for a year. And after that time, Oasis and Governor Cuomo is making every effort to make sure that at that time the state will be able to continue this important funding.
Kevin, come over here. We would be able to service 30 clients. The residents have the capacity for 30.
At any one time?
Yes,
Okay.
yeah.
And
How is the process after the person goes into the emergency room? How does this whole?
Process would be when they go to the emergency room, we get a call from the emergency room that the client is in there, and we literally would be able to, with the staffing that we'd be able to receive, to go directly to the emergency room with our vans, because we are mobile outreach, with a counselor and or nurse, depending on what the situation is, and literally transport them directly back to New Hope, 24/7.
So I apologize. I know that you said that heroin and opiates, they're not like life-threatening, but what if somebody comes in with a cocaine addiction? Would that be part of the program also? Or
Yes.
Okay. And then when somebody goes in for the treatment, how long realistically are we looking for them to be in there so they won't go out? And
Well, really, it's an individual call. It depends on the individual. But we're looking at an average of maybe 10 to 12 days. It really depends on the individual, because we're looking to provide stabilization. We'd like them to be stabilized. And during that process, the counselors and the staff will be in process of contacting rehabs, different programs, in order to link them to treatment, because that's the full gap of the program. Stabilization, linkage to treatment, and direct transportation to treatment. So it's kind of like a sealed container.
so the 12 days, then they have to go to treatment, and that can take weeks or months, or am I incorrect on that?
No, not necessarily, because we do have a working relationship with many of the rehabs, because we have been in operation for over 30 years. So we have good working relationships, so while they're here, they are screened and they're linked to treatment programs.
Right.
But the duration of treatment could be
That's what I
weeks or
meant.
months, so
Yeah.
the length of time you'd spend in it could be.
Okay.
And the theory here is to close that gap, so we don't have this gap in treatment, so that it is a seamless, consistent treatment from ER all the way through longer-term placement. And that the idea, again, is to strike while the iron is hot. These people are in crisis. These people need assistance. That's a very, very vulnerable time. If they don't get the help that they need, they might be right back out on the street again using, sometimes unfortunately, to dire results. So again, it's to strike while the iron is hot, to make sure there's a seamless transition into longer-term treatment. This is very much a crisis center.
And what's the dollar amount that you're pledging, and how long will that last?
Our office has committed $585,000 from criminal forfeiture. Again, no cost to the taxpayer for the year.
So it'll go from a year from now?
Yes.
Ms. Singas, I just had one other question. How was New Hope selected for this? Is there some sort of specialization that they have that?
Well, yes, currently New Hope is the only medically monitored crisis center in Nassau County.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.